My name is Melinda Bachini. I'm the Director of Advocacy with the Cholangiocarcinoma Foundation, and I'm excited to be here and share a little bit of the advocacy efforts that the Cholangiocarcinoma Foundation has done. I'm also an 11-year survivor of stage 4 cholangiocarcinoma, and cholangiocarcinoma, like lung cancer, has a lot of different molecular alterations. So they're starting to discover more and more of them, and we do have a population of patients that do have the NTRK fusion. So I did exceptionally well in a clinical trial at the National Cancer Institute, and because of that, I felt really strongly about finding a way to pay it forward. So I started doing advocacy, volunteering with the Cholangiocarcinoma Foundation about 10 years ago, and a little over 3 years ago came on as their full-time Director of Advocacy. I also serve as an advocate with the NCI Hepatobiliary Task Force, the ECOG-ACRIN GI Group, and the NCI Council of Research Advocates. So the Cholangiocarcinoma Foundation really strives to help our patient community get access to experts, to biomarker testing, to clinical trials, and to treatment. We recently launched our Biomarkers Matter initiative, and I invite everyone to go to biomarkersmatterorg and watch the animation that describes the importance of biomarkers matter. We did a cholangiocarcinoma specific version, but we also did a tumor agnostic version because we wanted to be able to spread this resource out widely to all cancer types. And there's also a provider version to help them understand. So we want to make sure it gets into the hands of all providers, patients, and caregivers touched by cholangiocarcinoma and all cancers. And we're also working hard to promote this easy to understand animation for all tumor agnostic patients, providers, especially in the community setting. So a couple years ago, a group called Accenture did an international research study of over 4,000 patients. And it really hit home for CCF, and because of it, it allowed us to focus our efforts of where we thought they counted most. That's why CCF strives to be an advocate, a convener, a connector, and a funder to all that are involved in the cholangiocarcinoma community. The study also found that patients trust information that they get from patient organizations and find them easy to engage with. So CCF does a good job of sharing information through providing patient advisory boards to industry and academia partners, hosting patient and caregiver support groups, and providing educational webinars. We're working closely with the FDA to provide feedback on revamping the eligibility criteria for clinical trials. We partner with Citizen to help patients gather their medical records and contribute to the research and donate their data to the research, such as through the patient registry. We partner with investigators to list their clinical trials on our website to be shared with the cholangiocarcinoma community. And we strive to provide strong initiatives to community providers and patients about the importance of biomarker testing. The study also showed that 72% of patients report that their condition has a daily emotional impact. So because of that, CCF offers the patients a way to connect through the Cholangio Connect Mentorship Program, where patients and caregivers are matched to other patients and caregivers who want to help others. It provides one-on-one support, and for the last 2 years, more than 273 patients and caregivers have been connected through this program. We strive to provide a robust education and advocacy program that reaches thousands of patients and caregivers by way of the website, social media, and email promotion. And we also have our own Dr. Giles, who provides emotional support through webinars such as targeting ways to deal with anxiety and depression. Again, the study showed that 88% of patients access content via patient organizations' websites and email. Our website had over 290,000 visits in 2019 with 761 page views and more than 5,500 weekly visits. And the countries that mostly visit the site are from the US, UK, Canada, Australia, and India. The same study also showed that patients put trust in the organizations, more trust in the organization information than they do sometimes get from their own doctors. They rely on the information about therapies and clinical trials. And so CCF provides a newly diagnosed program that helps patients navigate treatments, clinical trials, second opinions, connect with support, and let them know that they're not alone in this diagnosis. We encourage them to connect with our partner Citizen to gather their health records for free in order to have access to second opinions and clinical trials. We have launched the Clinical Trial Finder with Citizen, which will match patients to clinical trials based on their inclusion/exclusion criteria of the trial and the patient's most current medical records. The Trial Finder is free to the patients and will give them the opportunity to discuss options with their medical provider. We also encourage patients to check out our specialist map provided by data from Komodo Health. The criteria of being a provider listed on the map is the provider must treat and manage the highest number of cholangiocarcinoma patients, receive referrals from and work with many other cholangiocarcinoma specialists. We also want them to be able to publish research and participate in clinical trials. And this map gets updated quarterly based on the data from Komodo. We are also working on developing a nutritional resource for cholangiocarcinoma patients. Dr. William Lee, the author of Eat to Beat Disease, was our 2020 keynote speaker, and his presentation has been viewed over 200 times since July. When we do patient surveys, they report nutrition as one of the top 2 issues that they would like to be addressed along with clinical trial access. And cholangiocarcinoma patients also deal with unique nutritional issues and deficiencies not always addressed in existing resources. We also have a yearly conference, which we usually meet in person and bring in patients, caregivers, physicians, and researchers that sit at the same table and address issues in the cholangiocarcinoma disease area. But this year we had to go virtual, which was sad, but also good in the way because we reached a wider target. We had over 1,650 registrants from 49 states and 44 countries, and we were able to connect in ways that we have never been able to before. So those are just some of the ways that we participate in advocating for our patients, and I'm happy to take any questions, and I'm happy, and thanks for having me.